with our very special guest, Dr. Cherylynn Lee. And Dr. Lee is the manager of the Santa Barbara County Sheriff's Office, the Behavioral Sciences Unit. They also call that the BSU. And the BSU was created in 2016 to assist law enforcement when they encounter mentally ill community members and to improve communication and operations with behavioral health entities. Dr. Lee was hired by the Sheriff's Office in 2017 to develop and grow that unit. She holds a PhD and a master's degree in clinical psychology, and she also has worked for the Sheriff's Office in also Aegis, did I say that right? Aegis Treatment Centers, and which is an outpatient addiction treatment center. She managed over 350 patients and 30 medical and mental health staff. Dr. Lee also worked at UC San Diego Metabolic and Bariatric Institute, UC San Diego Department of Psychiatry and Preventative Medicine, and their Mindful Eating Conscious Living course. She helped create that. And the Department of Psychiatry at San Mateo Medical Center. So she has a wide range of experience. And Dr. Lee is also the founding member of the South Santa Barbara County Opioid Safety Coalition, chair of the North County Opioid Coalition, and co-chair of the Stepping Up Initiative. Welcome to the show, Dr. Lee.
Thank you.
So we're here. I'm very excited to have you, Dr. Lee, and we're here to talk about mental health stigma, mental health and suicide in our community, with a focus on the Sheriff's Office and also, or department, and also prevention awareness through suicide prevention and awareness. And we're talking about mental health stigma today because in recent news, did you know that mental health is the largest public health priority? It's also the largest financial burden of any health issue in the world. And that's according to the World Health Organization and the World Economic Forum. Also, the Centers for Disease Control have a report called Attitudes Toward Mental Illness. They found that stigma and embarrassment are two of the top reasons why people with mental illness do not seek help or medication. And so I always like to just reinforce the idea that mental health issues affect people from all walks of life. And what is mental health? I like to describe it as kind of like a physiological balance where your heart's beating at a nice rate, your thoughts feel relaxed, you kind of feel, a nice sense of peacefulness. And I think that gives us this balance that we need to feel peaceful. Suicide rates are on a dramatic rise, both locally and globally. And this time of the year, I know it's a challenging year with all the mudslides and fires. We're especially trying to come through that. And I think that people don't seek help or even know that we have resources available. I was wondering, Dr. Lee, how would you describe mental health?
That's a great question. I think mental health is the ability to live a life in line with your own values, and being able to do that without things getting in the way. So being able to connect with people and build relationships and have a sense of togetherness and community and feel supported, be able to have bad days when you're feeling bad and good days when you're feeling good, and be able to engage in life in a way that you want to. And I think that the antithesis of that is when things aren't working physiologically or psychologically, that might prevent you from doing the things that you want to do. And so knowing how to deal with those things when they come up, I think is a big part of mental health.
I love that you said that too. And we were talking just prior to getting on the air. I think that it's really important for us to realize that not every single day and every minute of every single day is going to be like ideal or maintained at that level. So, like Dr. Lee is saying, we're going to have really good days and we're going to have really horrible days. And I think I look at it like waves in the ocean. So how do we kind of meet the waves and notice them before they become so big, like a tsunami? And I love what you said about just connecting with people and feeling like we're, a part of a community. I think I had someone on the show and she was talking about being part of a tribe. I think we all want to be part of a tribe of people that understand us and can relate with us.
Sure.
I like to just kind of briefly talk a little bit about stigma. So I broke it down into social stigma and self-stigma. Social stigma is when we have attitudes and discriminating behavior that are directed toward individuals with mental health problems. And that's as a result of a label that they may have been given, like a psychiatric label. And then there's also self-stigma, which I find to be very common too, where the person internalizes their perception of discrimination. So if all throughout someone's life they always thought, oh, depressed people aren't fun to be around, then maybe when they get depressed, they think, oh, no one wants to be around me, right? Mm-hmm. So we really can internalize that. And I think everybody gets depressed and anxious. So we all have that in common. And the reason we're here talking about stigma, too, is because it really significantly affects feelings of shame and it leads to poor treatment outcomes. Mm-hmm. And studies have suggested that these stigmatizing attitudes towards people with mental health problems are widespread and commonly held. So we really need to take care of our mental health by being able to discuss these emotions, thoughts, and feelings within ourselves. I'm going to take a quick break and play a little public service announcement, and then we're going to be back on talking more with Dr. Lee about suicide and also the Sheriff's Department in Santa Barbara. So stay tuned. We'll be right back. Hi, welcome back to the Dr. Deborah Show. We're live at KCSB FM Santa Barbara 91.9. And we're here talking about bringing peace and calm into your life. I'm a clinical psychologist, and I'm also a UCSB alumni. I live locally in Santa Barbara, and this show's all about our community and how to create compassionate conversations about our well-being and health. We're here today talking about mental health and suicide prevention and awareness with a focus on our Santa Barbara Sheriff's Department. We're very excited to announce our special guest that we're going to be talking with, Dr. Cherylynn Lee. And Dr. Lee is the manager of the Santa Barbara County Sheriff's Office, and it's called the Behavioral Sciences Unit, BSU. And the BSU was created in 2016 to assist law enforcement when they encounter mentally ill community members and to improve communication and operations with behavioral health entities. So we're very lucky in Santa Barbara to have Dr. Lee to help develop and grow that unit. And she has a vast experience herself working at many universities and with many people, understanding how the interfaces work. And actually, Dr. Lee shared some history about her family that maybe she'll share just because it's kind of cool. Welcome to the show again, Dr. Lee.
Thank you, Deborah.
Do you want to share a little bit about your background? Because I just thought that was neat with your mom about
sure.
how you have some lineage there so you really understand this issue.
Sure. So my mother, her name is Deborah Glasser. She is also a psychologist, and she was the chief police psychologist for LAPD, so the Los Angeles Police Department, for a couple decades.
So we're really lucky because I think Dr. Lee not only knows herself, but also she grew up in a home where that was a topic of interest and also something that was important. So she really can understand, I think, with a lot of depth, how this could work well in our community and for other communities. I think that suicide is one of these topics that's just so hard for us to talk about. But I like to just encourage people to talk about it because it doesn't mean that someone becomes more suicidal by talking about suicide. In fact, it's quite the opposite. So if you do have suicidal feelings or thoughts, or you know someone that does, I would encourage you to talk to someone because I can guarantee you're not alone. And, suicide dates back even to 79 AD in Roman times. In Pompeii, which is in the southern part of Italy, they were completely getting bombarded by volcanic ash and rocks and pumice. And slowly people did begin to realize they were going to not be able to escape. And in those days, suicides were considered an acceptable form of death. Now people complete those in complex and varied ways. When I compiled some of the research from Santa Barbara, it seems that people use gunshots, hangings, overdoses, accidents, and sometimes a combination of these. And I know this is a very heavy thing to start with, and I'll probably have some people writing to me saying, oh my gosh, that was so heavy, but it really is happening in our community. Dr. Lee, how do you think that mental health and suicide prevention awareness intersect?
Well, I think that when people have a profound sense of helplessness and hopelessness, they, like with any problem, look for a solution. And sometimes when they're not aware of resources or when they don't have the energy to seek the resources that they are aware of, or there's that stigma barrier that you were talking about earlier, I think that people feel as if there isn't another way out. Mm-hmm. And so they opt for what they know or what they've heard of or what they've seen on TV. And that becomes a tool in their tool belt, so to speak. And a lot of times with certain mental health disorders, there's an inability to have insight, and that might be the nature of the physiology or just the psychology of the disorder. And so the person doesn't see past their current state of hopelessness and helplessness, and so it's hard to see in 2 years how things are going to be better. And so I think that, people see that as a viable option because of the desperation that can follow mental health issues.
So you're saying if we could get more into the prevention awareness piece, then maybe we could catch that much sooner.
Absolutely.
And the person would be more open to sharing that feeling of hopelessness or desperation.
Absolutely. It's not unusual. It's not abnormal to have thoughts of suicide or to think about what ifs. As human beings, we sort of catastrophize a little bit, and that's not necessarily a bad thing. It becomes a bad thing when it becomes your go-to or when you act on it. And so understanding the way that we think and behave and react to trauma and normalizing that response, I think would help a lot of people.
Yeah, that's key. I love that. I mean, I think they've done a lot of studies, too, on people who have attempted suicide and survived. And I think it's like almost 100% of the people said they wish they had never even attempted that.
And in fact, in the crisis intervention training we were talking about before we went on air that we provide for the sheriff's office, we have a component of the class, both in the 8-hour and the 40-hour course, where we talk about suicide. And there's a gentleman by the name of Kevin Hines, who's very well known. He attempted suicide by jumping off the Golden Gate Bridge. And we play a video in the course, and then we talk about it. And in that video, he mentions the moment my hands left the rail, it was an instant regret. And I think that's really important, not just for law enforcement, but the community to hear.
Yeah, I didn't realize that. I didn't hear that part of the video. It's true. Well, and it's just so momentary. It's like a fleeting, act of desperation. And also, suicide results in so much devastation, turmoil, and grief. And, the devastation remains in the hearts of those who have had to bear the tragedy. And then those questions arise like, what could I have done differently? Could I have saved them? They're very common reactions to grief and also to a sudden loss, such as suicide. And I think that also in Santa Barbara, I'm just trying to bring more awareness to that because I think that it is happening and maybe we don't realize that it's going on, or maybe we feel ashamed to talk about that we're not perfect. I mean, there is really no such thing as being perfect. So somewhere in the middle and to try to keep getting back to your balance spot is really healthy. And thinking of what Dr. Lee said is so true, that we all have thoughts of sometimes we get so exhausted and tired and of fighting whatever is going on in our lives that maybe that's what we think of is, I just don't want to be here anymore. But, suicide is much more complicated too because people usually have a plan and they've been thinking about it for a long time. So it's okay if you don't, feel, like living sometimes. That's very normal. And I think that, from the time we're children, we do notice the differences in others, and we're taught to look at the world from the lens of our upbringing and the life experiences that shape us. And I think that we're all wired a little bit differently. So some of us struggle more than others. And I'm just trying to still understand, too, why we've chosen to overlook the importance of our mental health. I was wondering, Dr. Lee, why do you think reducing mental health stigma is so essential?
Because I think everybody deserves the opportunity to live a life that they want to live, as long as they're not hurting others or hurting themselves. It's interesting when somebody has a medical issue, like, for example, a broken leg, you can see a cast. You can see that the person has an issue, so there's no question about the authenticity of their problem. When somebody has a mental health disorder, you have to be a good storyteller, and you have to support your claim that you're suffering from depression or anxiety. And so already, just by the nature of the fact that you can't see necessarily all mental health disorders, there's already that stigma just by the nature of what it is. If you had pneumonia, you wouldn't think twice about going into the hospital, and the hospital wouldn't think twice about treating you. With mental health, it's so different. It's not as black and white. It is gray. Every person suffering from a mental health disorder is different, even though they might all have the same diagnosis. The presentation, the symptomology, the etiology is always different. So it's a little bit more complex, and I think that adds to the complications of stigma.
I love that too. And, my dad is a physician, so he always said, well, however long you have the cast on, it takes, for you to heal in a way. And I do think I give that analogy or that example to people with mental health issues. I mean, if you've had debilitating or depression for so many years, it's probably going to take you that long, to recover. But it's okay. I mean, you just can be more patient, I think, with ourselves. But we live in a world that's so quantifiable. We want to have a label, a number. But when people present, with a panic attack, they go to the emergency room because it feels like they're having a heart attack, and they do have physiological symptoms. So they're very intertwined. And I think my idea at least, you can tell me what you think, Dr. Lee, is that in the next, 10 years, physics and all these things are kind of collide, and we'll may have a better understanding, and we won't need to quantify it, I guess, because it will maybe be explained that way. What do you think of physics and psychology?
Well, how much time do we have?
Yeah, that's a complicated topic. But I just think that there's going to be other ways of us explaining some of this that doesn't have to be so black and white. Like you're saying, there's more gray.
Absolutely. And when I was at UC San Diego, I treated some folks that would come into the hospital with panic attacks, and we would talk to them about the psychology of panic, and they said, yeah, that's nice, but I feel like I'm dying. And so there's a type of treatment called biofeedback, where you get hooked up to some wires, and you can actually see what it's like when you start to panic, the changes that happen in your body physiologically. And we teach the patient to work on their breathing, to control their breathing, and they can actually see the numbers on the biofeedback machine change. So they start to understand how their physiology and psychology is connected. And sometimes that's more comfortable for people than just talking about feelings.
I love biofeedback too. Yeah. I don't think there's that many people that do biofeedback. I mean, there's a couple in Santa Barbara, but you could check it out on the internet if you're curious what Dr. Lee's talking about. I think that just back to the stigma idea too, that if we keep working on prevention and some of these scientifically proven treatment methods, we could really radically reduce suffering and the global financial burden we spend. And those labels we have stem from misinformation, isolation, and negative attitudes. And I think, from lack of understanding really about a behavior or an appearance of communication that then gets labeled as not normal. And one thing I like to talk about with being normal is really normal, I think, relates much more to like a statistical idea of a bell curve. When you study a group of people, the people who fall in the middle, they're kind of considered quote unquote normal. But really, I think we all want to have health, and feel balanced. So that's what I think of as feeling normal. And I also think that the media, you were talking earlier about the media, I think so much of our information gets brought to us about depression or bipolar or schizophrenia or any mental health disorder in the movies we watch, in the shows we see, in the news we watch. I was curious, what has your work in the law enforcement field taught you about the attitudes held toward mental health?
Yeah, so it's, right now, mental health and law enforcement is a big conversation, not just in Santa Barbara, but nationally. I go to a lot of different conferences that are law enforcement focused, and it's hard to find one that doesn't focus in some way, shape, or form on mental health. What happened is, several years ago, the mental health institutions, the psychiatric hospitals were closed. In the spirit of opening more community centers for these folks with mental health issues. So the major hospitals closed, the mental health facilities didn't open. And so we see a lot of more people suffering on the street with mental health issues. And so law enforcement is called upon to help these people that are experiencing crises out in the community. So it's something law enforcement is dealing with several times a day. We started collecting data at the sheriff's office on how many mental health contacts our deputies are experiencing on a daily basis. And countywide, it's averaging about 5 or 6. And that's anywhere from somebody is having, suicidal thoughts. And so, their family member or their boyfriend who got a text is calling 911 to make sure that person's okay. Or, somebody with a major mental health disorder like schizophrenia is maybe having a psychotic break. And their family needs help. So you're saying that in Santa Barbara too, our attitude is we want to address the mental health issues, and in fact, like what you're saying is are you tracking that yourself, or is there a team of you, or how does that happen? Well, everything at the sheriff's office is a team effort.
Yeah, it's a major effort, I'm sure.
Yeah, so we have some folks that specialize in data collection, and it's really been a great working relationship. It's the first time the sheriff's office has hired a psychologist, so we're working through it. But so far, it's been really great, and we're really trying to capture what it is deputies are dealing with so that we can tailor training and the meetings that we go to, the community meetings, we can really build a system in Santa Barbara that works better for the community. There's oftentimes because of the media and what they present on law enforcement and mental health, you'll see the worst case scenario possible, right? So law enforcement shoots somebody who's mentally ill who called because there was a crisis. And that happens sometimes. And that's what people see, and that's what they feel like is going to happen if they themselves call law enforcement. And so that can sometimes prevent people from being safe or getting the help that they need because they're informed by what happened in Minnesota 2 years ago, and that's what sticks in their mind because it's emotionally salient. But our law enforcement are dealing with people in crisis multiple times a day, and they're doing a great job at it. I think people need to know that.
Yeah, it's a hard skill. I mean, we both went to school for over a decade just to kind of get our expertise. But I mean, I think anybody really can, whatever profession you're in, could really get training on how to help, if you're in a workplace, but also like Cherylyn's saying is to access the sheriffs or the police. I always try to encourage people to call them, if there's some kind of issue. And we do have what's called the restorative policing here too for homeless people to, instead of just putting them directly into jail, we try to help them with their mental health issues. I think people don't realize maybe the statistics, and I did compile, I wrote a column in September, and so I just put together the statistics from the Sheriff's Department I don't know if they're still accurate, but I had that in 2017, we had 61 suicides, and in 2018, and this was, I think, as of July, so we had 28, but I know that number is probably much higher now.
I think it's safe to say somewhere between 60 and 80 per year for the last several years, and it's been growing consistently. So the data that I have is from about 2011 through 2018. I don't have it in front of me, but we're seeing an increase in the number of completed suicides, and those are the statistics that we keep.
Well, and also suicide is just on the rise globally.
Right.
How do you think our governmental agencies, like specifically the Sheriff's Department, locally and nationally, accept or reject mental health stigma?
Yeah, that's a good question. I think that, I'll talk from a place of personal experience.
Sure. Well, and I was thinking because you grew up with your mom, too. Yeah. I don't know, did she talk about how, different law enforcement departments, either locally or nationally, accept or reject mental health stigma?
Well, so I will never forget the first time that I was asked to teach a room full of 40 cops about mental health. So you've got a female shrink who I was at the time 6 months pregnant, and I'm going to talk at them for 8 hours about mental health. So you get some interesting looks standing up there. But, there's a way that you can present mental health stuff to law enforcement that they get, right? Law enforcement wants tools. They became cops because they want to help people. And we were talking about earlier how mental health is not so black and white. It's kind of gray. And that can be frustrating for law enforcement. They want to solve an issue, and it's not always solvable, especially in that moment. Regular calls for service for crime-related issues usually take an average of about 20 minutes to resolve. Mental health issues are anywhere from 1 to 3 hours. And so you have deputies on scene who are tasked with these almost impossible situations. So the good news is that they're frustrated, and so they want more help, and so they're attentive. They appreciate knowing more about what it's like for somebody who's hearing voices, what that experience is like, so that when they're talking to that person the next day out in the field, they can slow things down a little bit. They understand that it's going to take more time, that maybe one person talking at a time is ideal. They're learning different tactics to help with this population. And so the better they are at it, the better they're going to feel about it, and that breaks down some of the stigma.
I also think for some reason I was thinking about teachers. I mean, they interface with so many kids, from kindergarten up through 12th grade and college, and how, I think that they're maybe afraid to contact law enforcement or know what to do. I mean, it's kind of a great idea to go into schools too, because it is part of the government, is to educate the teachers and the administrators, because I think it's a reality. I mean, whether people want to accept it or not, but right. I mean, I know we have had suicides actually and that was when I worked at the county in 2004 and 5. We had several young kids, very elementary age, that committed suicide. And so it is real. So it's important to start talking about it young, and not to think that you're like encouraging suicide, but that you're actually just, educating and demystifying that, what's going on. How do you feel, Dr. Lee, that a person receiving suicidal prevention and awareness from like governmental agencies could help a person through a mental health crisis?
Well, I think that the more that we demystify what a mental health crisis is and what it might look like and how it relates to suicidality, the more comfortable people feel at tackling it. So anything that's new or anything that's unknown creates a little bit of anxiety, and people tend to employ a defense mechanism called avoidance. And so they tend not to engage, and they want to avoid getting help or recognizing that that's an issue when it's early on. And so things tend to snowball with mental health, or it can, and so it gets worse. And so by the time law enforcement is called, now we're at, a level 10 crisis where we could have intervened at a level 6.
Well, that's why I'm trying to do this show. I have something I copyrighted. I call it the compounding theory of stress, because I think stress really does kick us into another place. And it's like we're talking about, you have something small that happens and maybe you kind of blow it off, and then maybe something else happens and that gets added in. And your nervous system can only just handle, and your thoughts and your, whole being can only handle just so much stress. And then what I call the kicker is it kicks you into this other place that you really have to do something about, that you really feel so depressed that you have to go get help, or you have to call a friend, or you have to get more sleep or eat better. But some people, like Dr. Lee saying, they get to level 10. So if you can try to nip that sooner, and I know it's hard because that's why the shame comes in, is, oh my gosh, I need help. There's something wrong with me. But you'd be surprised. Every person has something going on. I mean, Time Magazine just had their annual special on, did you see that, on mental health? Every year they have an annual special, and on the back it says every person will have mental illness in their lives. I like to use the word mental health issues because I think mental illness sometimes has a strong connotation to it. But just, if we're able to talk about mental health issues, mental illness, because there is an increasing need for these treatments, and just to be more mindful, to cultivate a more non-judgmental awareness. Dr. Lee, can you explain how suicide prevention and awareness operates in our government to offer mental health care, and how the Sheriff's Department interfaces with other governmental agencies? Do they do that? I'm sure they probably do.
Yeah, absolutely. So there's always, I know that NAMI, National Alliance for Mental Illness, holds some really great classes in our community about, or for family members of folks dealing with mental illness. And there's a lot of different resources through SAMHSA and different government organizations about suicidality. And there's the National Suicide Hotline, and there's a lot of different national resources. On a local level, one of the things that we've implemented through the Sheriff's Office is something called a CIT card. So when law enforcement goes out and they contact somebody in the community who's having a mental health crisis, what they do is they fill out this information on the card. I review it, and I give that information to behavioral wellness. So if appropriate, what they'll do is they'll go out proactively and contact that person and try to engage them in mental health services. And we're hopefully diverting people from the criminal justice system that way. We're helping people not get to the level 10, hopefully, where maybe they're seriously considering something like suicide. So we're trying to have more conversations between law enforcement and the behavioral health entities in the spirit of prevention.
Well, I was thinking of, I just had an idea about Cottage Hospital. I mean, I know a lot of hospitals, not just ours locally, are very impacted by mental health patients. We actually create, I think, a whole new wing in our hospital because we end up holding so many patients. And so there's just not a lot of room for people. We don't have enough resources yet. How does the Sheriff's Department interface with the hospitals and clinics, and do they go out in the field and just let them know, hey, we're here, and if you need us, we're available, or how does that work?
Yes and no. So since the inception of the Behavioral Sciences Unit, we've done a lot more connecting with behavioral health and physical health entities. So I'm at Cottage Hospital quite often talking about these issues. we, at the Sheriff's Office right now, are piloting a project called a co-response team, which is something that's shown to be effective in many other communities, where we have a CIT-trained deputy who's dressed down with a mental health crisis worker who goes out in the field and does 5150 evaluations. They're paired together in an unmarked vehicle, and they respond to mental health crises. They will relieve the patrol deputies who are on the scene. And if the person needs to be hospitalized, they can, in certain cases, transport that person directly to the hospital. And they speak with the hospital staff, so the social workers or the physicians, about what they saw and experienced in the field. So it's better continuity of care for that community member. So we're in the hospitals now, whereas when I first started, it was unheard of to have a deputy in the emergency room who wasn't there for an enforcement issue.
Right.
But we're changing the culture.
Nice. I love that.
Yeah.
Well, and I was just thinking, too, we have some clinics. I mean, really, if we could create more bridges, but I'm glad that you're there. I mean, I just know that the sheriffs and police interface so much, because I worked on the team that does 5150s. And also, if you don't know what a 5150 is, that's when someone gets taken against their own will for mental health issues. And there's a whole process that you get trained in to do that. You can't just take somebody. It has to be a very viable reason. And actually, Dr. Lee and I were talking about how in Santa Barbara that we are, I guess you're saying we're one of the few counties where we don't have our police and sheriffs do 5150s?
We are the only county in California where law enforcement, and that sheriff and the police departments, don't write their own 5150 evaluations. So how this plays out in the field, for example, is if law enforcement, somebody calls 911 because their loved one is having a mental health crisis, maybe they're violent. So law enforcement shows up and they determine maybe the person is in need of a 5150 evaluation because perhaps they're acutely psychotic, they're really, really sick. What they have to do then is call the mental health team to come out, explain what happened, and because of staffing issues, drive time, just general work-related stuff, there might be an extended wait time for that mental health clinician to get on scene. So you have a law enforcement person waiting with somebody in crisis for sometimes, and we've seen this, it could be an hour and a half that they're with somebody who's experiencing a mental health crisis. So there's a couple different outcomes. The person and the deputy have rapport, and the person gets de-escalated. The clinician doesn't see the acute crisis or that behavior, or the person who's in crisis escalates, and maybe the deputy has to go hands-on for their safety or the community's safety, and that's not necessarily ideal. Or the person might end up going to jail. And so in other communities, not that those outcomes don't happen, but there's more fluidity sometimes of the person in crisis getting to the services faster because the law enforcement person can detain them against their will with that 5150 form and take them to the hospital. In our community, it works a little bit different. So that being said, this co-response team that I mentioned earlier of the mental health person and the deputy going to the call at the same time really eliminates that issue of the wait time and having to tell the story twice. You have that response immediately. We've seen great success with that pilot program so far.
I think when I worked on the MAT team, and I'd be on call all night long, we didn't have enough clinicians actually to go out in the field. So I worked collaboratively with the police and the sheriffs and the paramedics. And the paramedics were the ones that actually wrote the 5150. I would certified or something. I can't remember the exact word. So what you're saying is that if we had a little more fluidity with the people who are going on the scene, usually the police, just so you know, when they come initially, at least I know in Santa Barbara, you could correct me if I'm wrong, they're coming, one, to make sure the scene is safe, that there's no weapons or things like that. I was just having a little light bulb moment, and then we're going to take a break in a minute, but I was thinking how you have all this experience with opioid addiction, and we have this huge opioid crises. And I even saw how on the news, and I don't really have TV, but I did see that the shooter for the person that was in Thousand Oaks, who was a returning veteran who had a weapon, apparently it was being, taking opioids. Do you think the opioid crisis how do you think the prescriptions and all the things that are going on, do you notice just briefly if there's any impact as far as suicides from that?
Sure. Addiction is a very powerful situation, and we talked earlier about hopelessness and helplessness. What happens to the body and the mind when somebody is going through the throes of specifically opioid addiction? The withdrawal can be so terrible. And sometimes what happens is the person runs out of, maybe it's prescription pills that they were using, and so they start to engage in criminal behavior, or start buying pills on the street, or stealing because it's an expensive habit. And then they suddenly forget who they used to be, or they're not that person they used to be anymore. And so we start to see those layers of hopelessness and helplessness build up. And certainly that can lead to the suicidal behavior.
Well, and I was just thinking it would be cool or really amazing if we were able to educate physicians too about, a little more in depth about these pieces with the opioids and the pills and the possible outcomes for mental health issues. Do you interface at all? I know there's, a lot of discussion about guns, and we don't have to get into guns if you don't want to, but I was just curious, like with the sheriff's department, I know that's a scary situation because I have people I know that work on the team that go out, and you never know what you're going to see. In fact, when I talk to police officers, they always tell me those are the scariest phone calls because they just don't know. It's very ambiguous. I was curious, do you have any thoughts about that? I mean, I know that's a big topic that I probably need a whole show on, but I was just curious because I know you have a history of all these people.
Absolutely. So when somebody is detained on an involuntary hold, like we talked about a 5150, and they get sent to a psychiatric facility, there's an automatic 5-year weapons ban. So they can't own or purchase firearms for 5 years. If that person goes to the hospital voluntarily, or if they don't go to a psychiatric facility, there's no weapons ban, and that's a concern, especially if the person was psychotic, so they're not understanding the choices that they make, or they're suicidal, right? We don't want that person to have that access because suicidality can be so impulsive, and guns are very lethal. There's a law that passed just a couple of years ago. It came out of Isla Vista because of the shooting in Isla Vista. Yeah. It's called a Gun Violence Restraining Order, a GVRO for short. It's something actually Santa Barbara. We're sort of the experts in this, in GVROs because of where it originated from. It's a way for family members and law enforcement to take somebody's guns for a short period of time. It's 21 days initially. It can be extended through a court process, but it allows for the government to take those weapons away while a person's in crisis, in the hopes that they get treatment that they need, or that they move past their suicidal behavior, or whatever the case may be. There's a wide range of reasons why the GVRO is used, but it's really helped with a gap that we've experienced in the law enforcement community.
So you're saying that if there's someone that in our community that has a gun, and if a family member or someone in the community is concerned, can it be anybody, they can call and talk about this gun violence restraining order?
Well, so anybody can call and ask about it.
Right.
You're welcome to call the sheriff's office and ask about it. Family members can start the process of the GVRO, not community members necessarily, but if you have a concern, absolutely. We can always do the research if it's a valid concern and go from there.
And how would somebody, is there a phone number they would call, or how does that happen?
The general phone number for the sheriff's office, I know if you Google the sheriff's office, you'll find the phone number. I think it's 681.
We'll provide it at the end of the show.
Okay, that's a good idea.
Because I think that's a good resource, actually. I just think when I worked at the county, a lot of family members and, people, loved ones, have a hard time knowing what to do and how to navigate through the system. And so even though I am certified to take someone against their will, I would spend all day, I was telling Dr. Lee, or all afternoon, finding resources and figuring a system of care for that person so that person can have some relief and actually some transition plan instead of just kind of going to the hospital or going to jail. I try to help people in the intermediary piece. And I think, California adults with mental health issues really are not getting, we need more resources too. That's another issue, is how we tackle that as people are coming out and wanting to get help, which is so awesome. I notice magazines and stuff that therapy is actually kind of a cool thing. So it really is an investment in yourself. To get help and to just talk about things that are going on in your life and just know that you're not alone. So coming up on the show, we're going to be talking a little bit more about mental health prevention and awareness regarding suicide. Hi, we're live at KCSB FM Santa Barbara and 91.9, and this is the Dr. Deborah Show. We're talking about bringing peace and calm into your life, and I'm a clinical psychologist. I'm also a UCSB alumni, and I live in Santa Barbara. And this show is all about our community and how to create compassionate conversations about our well-being and health. We're here today talking about mental health and suicide prevention awareness, which is one of my favorite topics to talk about, but I know a lot of people have a hard time talking about suicide. But did you know that suicide is the second leading cause of death globally between 13 and 44-year-olds? So it's really a rising issue. And so I'm very excited to announce again our special guest, Dr. Cherylynn Lee. Dr. Lee is the manager of the Santa Barbara County Sheriff's Office Behavioral Sciences Unit, and it's called the BSU, and it was created in 2016 to assist law enforcement when they encounter mentally ill community members, and also to improve communication operations with the behavioral health entities. So we're very lucky in Santa Barbara because Dr. Lee was hired by the Sheriff's Office in 2017 to develop and grow the unit. We've been talking about mental health stigma and how it affects sufferers, both in terms of their role in society and their route to recovery. And it's not surprising then that attention has most recently turned to developing ways in which stigma and discrimination can be reduced. And we're here with Dr. Lee, who works in the mental health kind of governmental political policies and suicide prevention awareness, talking about some of the ways that mental health impacts our communities. I was wondering, Dr. Lee, have you heard of any campaigns or organizations in the governmental arena pertaining to like sheriff's departments that is there like a campaign or something that is labeled as such that is working to reduce mental health stigma?
Absolutely. It's a great question. There's something called the Stepping Up Initiative, which is a national movement, if you will, to reduce the number of mentally ill persons that are in jail. And our sheriff and our director of mental health for the county together signed this proclamation that we were going to have department heads, including some folks from the Board of Supervisors, attend bi-monthly meetings where we talk about how can we help this problem in our community. So Stepping Up started about a year ago or so, a little more than a year ago, and we have different department heads, and we meet and we talk about, we identify what are the problems in our community, where are the gaps in services, what does Santa Barbara need? So there was a 2 or 3 day workshop held where NAMI was there, probation was there, the sheriff's office was there, the hospitals were there, we had mental health there, and we're all talking about what is the need in our community. And then everybody voted on the needs. And there's a document available if you'd like to see it. I'm happy to get that to you.
Great.
And so each organization or entity that was there developed goals. So here are the problems, and each organization by itself decided these are the goals that we're going to work on. And so we have this working document as a community to look at and measure our success, and are we meeting the goals that we set? Can we reduce the number of mentally ill persons in our criminal justice system? The national numbers for mentally ill persons in jail is about 20 to 30%. We in Santa Barbara did a one-day snapshot about a year ago because of this workshop. We looked at how many people in our jail were at one point in time or another or currently open to the county as a mental health client. On that particular day, so I don't want to give the impression that this is always the case, but on that particular day it was 52%.
High number, yeah.
Which is a lot higher than the national average. And so those of us that work in the healthcare and law enforcement community, anecdotally, we knew this. But now that we're collecting data and we have this initiative called Stepping Up, and we're developing goals and we're meeting these goals, we're hoping to look at the data and see what kind of an impact we're having.
Well, and I think also maybe because Santa Barbara is more psychologically or mental health aware, that we are going to notice that maybe we'll be more open to saying, okay, this person does have this versus maybe denying that person could have it, if they don't have it currently, but maybe they did in the past. Sure. But I know, the jail system is, I was talking to Dr. Lee before we got on if she wanted to get into that topic, but I mean, I just have so much compassion for people who end up in the jail system because I think that they are already compromised with their mental health issues. And I know I've treated people who have worked in the medical field at our jail, actually. And then one of their kids was at the jail and they couldn't interface with them. They couldn't get the treatment. And so I'm really hoping, I mean, I don't know, what is our jail? How does that work with, because I remember we used to do a lot of referrals over to jail mental health. How do people get mental health services when they're incarcerated, like in jail?
Great question. So there's a couple of different ways. So the first way is self-report. So if somebody is coming into custody and they let the intake nurse know that they have mental health symptoms or a mental health disorder or they're on medication, the mental health team within the jail, which is currently called WellPath, that's the organization the sheriff's office contracts with for medical and mental health services, what they'll do is they'll get the patient or the inmate to sign what's called a release of information so that they can communicate with that person's healthcare provider. And, hopefully they can see the psychiatrist that works at the jail and get on medication. There's something called the Sheriff's Treatment Program that's in the jail that helps people through mental health and addiction and recovery. So self-report is one way. There's also a new form that the Behavioral Sciences Unit and WellPath together created, where when somebody is taken to jail, sometimes they don't always report that they have a mental health disorder or they were having symptoms of a mental health crisis, but the officer or deputy who arrested that person saw it in the field or their family member told them. So what the officer can do is write down this information on the form, hand it to the intake nurse, and now that nurse knows that mental health needs to do outreach to that person while they're in the care of custody. And so it's not just through self-report, but through what the deputy is seeing, so that there's more continuity, less people are falling through the cracks.
Well, and I know I'm on the board of this HopeNet of Carpinteria, which is a suicide prevention awareness group. And what we're doing in Carpinteria is we're trying to get more behavioral screenings in lots of different areas, like in the schools. And I mean, I think the jail would be actually a great place. I mean, I would guess a predominant portion of people that go through that system have mental health issues. And also in our schools, we have, kids, unfortunately, that have mental health issues. So I think we need more programs. And I love that you have these different levels. So there's kind of the self-reporting, there's the sheriff's treatment program, there's some outreach. And I have heard people that go through the program seem to learn a lot and feel like, it's like real application. It's not like just kind of going through some ideas. Mm-hmm. So this increased awareness and the communication are really key ways to move toward acceptance and health. And I think, as we've already described, people tend to hold negative beliefs about mental health problems, regardless of their age or knowledge they might have of mental health problems, or even if they know someone who has a mental health problem. I was wondering, Dr. Lee, how can we put more governmental policies for law enforcement? And I think you're, by the way, doing a great job. I'm really happy to hear that there's a lot of action happening. How do you think, just in our community, or, I mean, if there's someone in another state, because people do listen from other places, how do you think we can put more of these policies for law enforcement into our lives that would help to create mental health? How can we support the law enforcement, and how can they support us?
That's a great question, and I'm gonna give my personal opinion, my personal answer. Law enforcement needs funding to help deal with mental health crises in the community. When somebody's in trouble, when their loved one is in need, we call 911. That's what our culture tells us to do. And so law enforcement is always going to be that first person on scene. Mm-hmm. So they need to have the training to know what they're looking at, to be able to identify that it's a mental health crisis so they can get the right resources. Programs like co-response we know works. Right now we talked about how it's being piloted. In fact, Santa Barbara Police Department is also going to be piloting this program, but we need funding to continue the program. So I think law enforcement, we want to see them have more tools, more options than just jail. And to do that, it's a funding
issue.
Yeah.
I know, it's too bad we couldn't put more taxes toward that, because I'd like my taxes to go toward that. I just feel like it's such a tantamount issue. And it's true, the volume of people that the police and sheriffs interface with is huge. We were actually talking a little bit about people in law enforcement and their mental health, and mm-hmm. how we can support. I mean, I know during all the fires and mudslides, and as we come on the anniversary of those, I just always am wanting to honor all those first responders, and the impact that had on them, because they deal with so many things. So not only do we need more funding, we also need more resources actually for, I think, our law enforcement, because I mean, just as a mental health worker, it takes a lot to bear all of that. And I think that, if we could reduce mental health stigma, we could kind of break down this wall and create the compassion and conversation. And then that builds inclusiveness and teaches others what we've learned. So we all have something kind of to share. I did kind of go over the news a little bit because I do that every week and just see what's going on. And I mean, there were several things I was trying to kind of look in Santa Barbara, but also just I was looking at, it said that in the federal court, that suspected suicides were announced the same day that a federal court appointed a special master who oversees prison mental health care. And I guess he criticized California correction officials for proposing that they be allowed to start negotiating an end to federal oversight of suicide prevention efforts. I don't know if you heard about that, but that was just something I Googled and found there. But this special master's name's Matty Lopes. He called the state's proposal incredibly premature, given the continued problems outlined in the experts' report, which was released Monday. So it's very interesting, the two sides of the coin. But the attorneys that are representing these inmates say that the state suicide rate is, for the second year in a row, on track to exceed 24 suicides per 100,000 inmates. So there's been, these attempts by people like on death row and whatnot, too. So these are people who are in isolation. Then they were talking a little bit in the news about a sheriff's officer who actually committed suicide himself. And I just wanted to honor him because this Mercer County Sheriff's Detective, Pablo Santiago. And the picture of him, was just at some kind of a barber shop. But, I mean, he ended up taking his own life. Potentially they were saying that it's the tragedies, it's a sad reminder of the pressures that the law enforcement officers experience on a daily basis, and this is someone who gave their life really to work and help other people. So I just wanted to honor Officer Pablo Santiago too.
Thank you. Thank you for doing that. In fact, our community suffered a loss of an officer by suicide, Lompoc Police Department. And that was just, that was within the last couple of years. There's a lot of stigma, of course, in the law enforcement community about seeking help yourself. So through the training that we're doing, the CIT training, we also have in the 40-hour class, a large component about officer and deputy PTSD, post-traumatic stress disorder, how to mitigate the effects of accumulative stress. We also give them resources. Yeah. We want them to be healthy. And
also it's important, I know, like when I go to the coffee shop, I mean, if I see a policeman or a sheriff, I always just go up and say hi. I mean, they're people just like us, and they're out in the field working to protect us. And even if it doesn't work out as perfectly as they hope, I think, they really do have the positive intention of trying to create safety in our community, trying to help others. So, it is, if you know someone who's in crisis, reach out, especially, if you know someone in the law enforcement as well, like we're talking about today. But just, I think it's important to remind ourselves that it's a heavy job, too, to not just to be demanding and say, okay, we need more. But also, the sheriffs are out there. I also saw, I think this was back in September, it looks like, but there was a suicidal subject on a bridge on Turnpike. And I think that the sheriffs were able to really help by continuing to speak with this person, and then the fire personnel arrived. So it was a very collaborative effort. So I think that things are shifting in our community to help people when they're in these crises.
Absolutely. I remember that case well. These guys do this every day. So we were talking about how as clinicians, we have years and years of training. As law enforcement, they too have years and years of on-the-job training out in the field. And, we've got great team members, like we've got, our hostage negotiation team that they train monthly on how to talk to people who are barricaded, who might be suicidal. Our SWAT team is trained on how tactically to help, make sure that the community is safe and that person is safe.
Which is great, because actually I'm big into preventative medicine. So that's what we need. We need to have that kind of front-loaded training, because it's going to have, we're going to have those unfortunate situations. But that makes me feel a little more reassured. Well, Dr. Lee, thank you so much for coming on the show. Do you have any final words of wisdom for our listeners?
I Thank you for having me. It's been great. I think we could probably go another 2 hours.
We could.
If
We'll
we
have you come
the
back
time.
on. Well, I was thinking maybe you could come back on and bring a sheriff or someone
Sure.
that is, as an example if you want to
Yeah.
do that again.
I think my words of wisdom would be, I can recognize that calling law enforcement for a mental health crisis can be nerve-wracking, but really they are trained to help. You're always welcome to call dispatch and ask for somebody who's trained in CIT, so you get somebody that's gone through the additional training and if you as a community member are in a position to advocate for these programs that we're trying to build that requires funding to be successful, let your voice be heard.
Yeah, I think we need more legislation. Yeah, so make sure to speak up and then we can have more care, we can have more resources, and also I think we would all have a better sense of inner peace if we could be more accepting of each other. We can work together and we can help create a supportive environment that can empower and care for the individual. And some ways we can work together are volunteering, checking in with ourselves, learning about other cultures, and getting accurate information from accurate, reliable sources. Make sure they're not from random scientific studies. And I think this leads to understanding, including, and caring. Can you imagine a world where we can share our feelings and thoughts more freely, where we can move toward health for all human beings? And there's a lot of work to be done. But if we each do our part toward ending negative perceptions about mental health and we raise awareness, we can live in a more loving, safe, and accepting world. So I want to thank my very special guest, Dr. Cherylynn Lee, for coming in today and sharing her wisdom. And if you have other questions, please write to me on my Facebook page, The Dr. Deborah Show. I like to give a shout out to HopeNet of Carpinteria. It's a group of concerned citizens who provide education and resources to prevent suicide. And our mission is to improve the mental wellness of our residents and to lessen the number of attempted and completed suicides in our community through information, support, training, and advocacy. And we hope to create a stronger safety net. So if you or someone you know needs help, call the National Suicide Prevention Hotline at 1-800-273-8255 or the Santa Barbara Access Line 24 hours a day, 7 days a week at 1-888-868-1649. And then Dr. Lee, did you have a number for people as well?
Just the number for the sheriff's office is 805-681-4100.
Great, and we'll look forward to seeing you next week on the Dr. Deborah Show.